if you want to watch it again. Let me make sure that's recording. I think it is. And I'll just try and admit people as we go along. But yeah, welcome to the Everything You Need to Know About Studying and Becoming a Pediatric Nurse. I've got two fantastic guests alongside me. I'm just going to briefly introduce Future Frontline. If it's something new or if it isn't something new to you, then I'm going to bore you to death, but bear with me for 2 minutes. So Future Frontline is completely free of charge, educational platform, resource, always will be free. We have a website where we have blog posts written by aspiring and current healthcare students as well as healthcare professionals. We have Instagram page, Facebook group, podcast, you name it, we've got it basically. And obviously this is a nursing event, but as you I'm sure are all aware, the NHS is so much more than doctors, nurses, dentists. So we really want to educate aspiring students about all the different roles. So I really recommend you watching some of the other Future Frontline events on YouTube or come to some upcoming ones. And again, we believe in a future of collaborative practice at the centre of everything we do. So that means we believe in the sort of multidisciplinary team. We want to break down any hierarchies there are within the professions. Who's speaking? Mute. Mute. Sorry. And also socioeconomic status should never ever be a barrier to pursuing a career in healthcare, hence why everything will always be free. I can absolutely guarantee you that. I guess I should introduce myself. My name is Tash. I'm a medical student, but I am the founder of, oh, hang on a minute, how do I get rid of this person? Never mind. I'm the founder of Future Frontline. Yeah, you probably have seen me around on social media, but yeah, I'm just really passionate about this multidisciplinary team stuff. So I'm really happy to introduce our two panelists today. So I've got Sophie, who is a qualified paediatric nurse working in London, and then we've got Samanpreet, who is a paediatric nursing student at Birmingham. So yeah, we're just going to have a really nice chat. First of all, let me go to some of your answers. Let's hope some of you have replied to my Mentimeter, otherwise I look like a really lame teacher. Oh yay, answers. You want to learn about nurse work on spinal. Interesting. Information about nursing I saw on your Insta. Okay, so just a general overview, I guess, will be helpful. So maybe I can ask, hang on a minute, let me leave this. Sophie, could you maybe share why you chose to be a paediatric nurse? And I think, I mean, I'll ask Samanpreet this as well. I think it would be helpful maybe to answer why paediatric nursing and maybe not adult nursing or mental health nursing as well. So Sophie.
I actually did my nursing training a bit later. So I was 24 when I started doing my qualification. So I have a degree actually before. So nursing wasn't something that I thought like straight away from school that I necessarily wanted to go into. It was kind of a little bit later down the line. I just considered going into healthcare of some sort. Particularly pediatrics, because I've always worked with children. So from kind of like 16 to 21, all my jobs, I worked with kids in some way or another. I just enjoy working with kids, which was the main drive behind wanting to work within pediatrics. My mum's a nurse, and she's adult trained. So it wasn't that I didn't want to work with adults. I just was more interested in working with kids. And I enjoyed it more. So I just kind of thought, you know, I'll go down that path rather than going down any other path, just because, yeah, I was passionate about working with kids.
Amazing. And would you briefly be able to introduce maybe where you work, what kind of children you work with maybe, or is it very general? What have you been doing in the last year?
So I work in central London. I work at the Evelina London, which is one of the other children's hospitals, which is in central. So when I became a newly qualified, I did something called a rotation. So for my first year, I kind of rotated around different wards. I did my first 10 months on general medical. So general medical is just very varied. You just get lots and lots of different things that come in, from kind of just your children with asthma, you know, your children that have just got kind of ear infections are coming in to get just your normal kind of, I always try and explain general medicine as, if it doesn't fit under a specialized umbrella, it goes to general medicine. So I was there for 10 months, and then I went to orthopedics and spinal, which is where I still am now. So I was there for another 10 months, and then my time kind of got a little bit jumbled up because of the pandemic. So I ended up being redeployed twice to adult intensive care. I also worked on cardiac for a short time within pediatrics. And I also worked in like general medical HDU for a short time as well. So if it wasn't for the pandemic, I probably wouldn't have got such a varied experience. But yeah, I'm back in my normal ward now. So we've just actually expanded, and we're now orthopedic, spinal and general surgery. So surgery, you're looking at kind of, you're getting people come in with appendicitis, kids that are coming in to kind of get their peg buttons inserted, anything that they're going in and taking them to theatre to operate on. So I'm learning lots of new things at the moment, because I'm learning a completely new specialty.
Oh, thanks so much for explaining all of that. That really makes sense why somebody said spinal nursing. I was a bit confused, but that makes sense. Great. And Samanpreet, why did you choose to study paediatric nursing, and why do you want to become a paediatric nurse?
So for me, I think it's quite a lot, because I've had so many younger cousins who are children, and taking care of them, I think I came to know that I'm so good at doing this job. Like, I was doing the stuff right and things, and then I was really interested into doing it because I felt like children don't really take a sick role like adults do. So even when children are sick, they don't portray that kind of stay in bed, not doing anything, whereas adults do that more. So instead of picking the adult line field, I thought, why not go for children, because they're always going to be that vibrant, that ready to just do stuff. So even when working with them now as a student nurse, you see in hospitals, they'll have like the medication time, or like time when doctors come in to do bloods and stuff. And then as soon as that's done, they're back to themselves, playing, socializing like normal. Whereas adults are more kind of laid back. So when they're ill, it's just like, this is the role, I'm ill. So I think I prefer the children line of trying to get better. I'm doing good, and kind of just the outlook on it. And as a student nurse, I worked in 2 wards at the moment. Because of COVID, it kind of got restricted and shortened down. So I worked in a liver ward, which was patients coming in and kind of staying for a limited time, whereas in ward 18, which I am currently, it's hematology and oncology ward. So we have cancer patients and palliative care. And working in palliative care, I really realised that maybe it's not something that I'd go into as a specialist, but I've learned the fact that with cancer patients, there's still that kind of hope, working with them, working with the MD teams, and kind of getting them where they want to be, even if it means they won't get through it to the end, but giving them best as you can, to the best outcomes, to meet whatever needs you can. But
Amazing. And I think palliative care is so important. It's something that I didn't really think about that much when I was like an aspiring student. But you can really we talk all about quality of life, and I definitely think you can make a real impact on people's quality of life in palliative care. Great. I always say in these like events, or whenever I do a podcast, I always talk to people in like a different area of healthcare, and by the end I'm always like, why didn't I consider that? Honestly, I've been signed up to be a paramedic, occupational therapist. Great. So maybe we could talk more about kind of a typical day in your life. Obviously, the nature of healthcare is so varied, which is the nice thing about it, I think. But what's being a first year? You're a first year, am I right in saying?
Second year,
my bad, I'm so sorry. So what is being a second year pediatric nursing student like? Obviously the pandemic throws a bit of a blip, but how does it work kind of with your lectures? When are you on placement? What do you do on placement? That kind of stuff.
So placement's divided. So sometimes we'd have a block placement, so it'd be full-time placement, and that's like 12 hours long day or night shifts. And then there's a shortened placement, which is alongside the theory work. So we'll have our lectures, but obviously now because of the pandemic, it's all online. So we'll have the lectures, and then it's like part-time work placement with that. So because the lectures are recorded, you basically do them when you get the time to do it. with your placement. So you'll do like 8 hours 3 days a week or 2 days a week, go back to your lectures, and then you'll carry on doing that. And then we have segments where it's just assignment and then it's placement again. So currently now I'm just waiting. Next week I start my next placement, and this time it's block placement again. So it'd be like full time, 12 hours a week and stuff. So looking forward to that. But it didn't really get a change a place where I was before because of the pandemic. They're trying to keep us where we was initially, so that there's not too much moving around and things, which makes sense. But it would be nice to get a more overlook on the different wards and stuff. But yeah, that's it really.
So what sort of things do you do when you're on your placement?
So when I'm placement, we usually put with another nurse. So as a student, you go in, you kind of do an introduction with the patient that you've got for the day, and then you do like an hour-to-hour review. So you'll get out a review sheet, write down what the interventions you will be doing in the day, including medications, if they're BD, or however many hours. So you write it all down so you don't forget anything. And then if anyone's on fluids and stuff, you need to remember you need to do weights and heights like every day, just so when the doctors come to check the documents, it's all there and they don't have to be waiting on you to kind of get stuff down. So when they come, it's quicker to get stuff done. And then it's just working with the carers to see how far they've come, because not every day you'll have the same patient. Every day it's a different patient usually, unless you're lucky to get the same person, but it's harder to know what they've been there for, what's been done previously. So to catch up on there, just like read their notes previously made from the nurse and kind of catch up on there. Yeah.
Great, thank you. That was a really good oversight. And Sophie, what is the typical day in your life, if you maybe your normal pediatric nursing life that you're now back to?
So I do 12.5-hour shifts. So in the morning, for half an hour, both the day and the night team are on at the same time. So we go and have handover where we get given our allocation for the day, and we also get given a safety briefing. So safety briefing kind of just outlines, is there anyone on the ward we need to particularly like keep an eye on, if there's kind of any issues with families, with kind of just anything we need to be aware of, we're told in the safety briefing. That's normally about 5 minutes. We then come out and we take handover. So basically you go to the nurse who had them on the night time, and then for about 15 to 20 minutes they'll just run through everything that's happened on their shift, everything that we need to know, kind of the upgoing plan for the next kind of 12 hours, but ongoing as well. So then you kind of the last 10 minutes of handover then have time to write down kind of a plan of the day, what you need to do, what you need to hand over to the medical team when they come and review, and then just kind of the day-to-day sort of tasks that you need to do, like making sure your patient has a wash, making sure that, you know, you're checking in with parents, family members and things like that. And then obviously just making sure you write down all your meds and stuff so you know what you're doing. Everyone kind of does it differently. I like to write myself out like a little table. So I have like every hour of the shift, and then I'll write what I need to do in that hour. And then some people, I don't know how they do it, but some people just have it in their brain and they remember. I can't do that. I also like being able to cross off every hour that I've done like what I need to do. But yeah, that's kind of a general overview of like the morning. We'll wait for ward rounds, so we'll wait for the doctors to come round and review their patients, because obviously they could come round and things could change, and then just dependent on kind of your patient is how often you're going to kind of do observations on them, just general checks and stuff. It really kind of just depends whether your patient is considered low dependency or high dependency. So if they're high dependency, then you're kind of, they're a little bit more unwell, or they need more closer monitoring. Or if they're low dependency, they're kind of more clinically stable. Kind of from my point of view, the ward that I work on, if they're low dependency, they're more kind of working towards being discharged or going home, and they don't need as regular kind of checking. So yeah, that's kind of a normal day.
So how many patients would you kind of look after in a day, or is it dependent on how, if they're high dependent or low dependent?
Yeah, so it really just depends, yeah, like you said, on how much kind of care they need. If you have high dependency patients, they kind of try and limit you to have kind of 2 to 3 patients. where I work at a tertiary centre, so like where it's a very big hospital, we're very lucky that we have we do generally have quite good staffing, because I know other hospitals, like they'll be taking on kind of like 5-6 patients. So yeah, it just really depends. It kind of ranges from like 2 to 5 patients, but like it just really depends on the level of care that you need to provide to them.
Great, yeah, that makes perfect sense, and thank you for sharing sort of a brief overview. We are going to do like a general Q&A at the end, but if anybody has any questions on sort of a day or weekly sort of structure of either a student pediatric nurse or qualified pediatric nurse, pop them in the chat now. And while we're waiting for those, I thought we could think of a couple of questions that are quite helpful to kind of address in your personal statement, and those are sort of, what skills do you think are needed to become a pediatric nurse? So imagine that the guys here watching you guys speak are following you around either on your placement as a student or around as you're working. What kind of skills would they see you using and doing?
I think that no matter what sort of nursing you do, whether you choose to do paediatrics, whether you choose to do adults, mental health, learning disability, the core of being a nurse never changes. If you followed a nurse round, you'd see, you know, communication is so important in everything that we do. It's particularly important as a paediatric nurse because, you know, we don't have to just communicate with the patients, we've got to communicate with the families, the parents and the carers, because they're so important with our care. They know their children best. And obviously you can imagine that some of our patients, obviously if they're too young, they can't necessarily tell us what's wrong. Within my hospital, we look after a lot of complex children with learning disabilities, or just with complex needs that aren't verbal. So parents are an invaluable tool to be able to help us know how to care for our patients. So communication is like so high, it's like in the heaven of the list, like it's so high for me. And it's just one of those things that as a student, I think you just, in the 3 years, you just learn like communication. It gets stronger because obviously it's so nerve-wracking when you first become a student and you have to kind of like go and introduce yourself to parents and stuff, but you know, the more placements you go on, the more experience you get. Like I just think, yeah, communication is just so important. What else would I say? The qualities. Time management as a nurse is also very important. No 2 days will ever be the same. You might have a day that's like nice and steady, but then, you know, the next shift, it could be so hectic, so busy. So you need to kind of be good at managing your time or working out ways in which you can improve that, your time management. I think when I was a student, I remember working with certain nurses that were like really good with time management, and I kind of like wrote notes and like just remembered in my head like how, like what sort of things that they did. So like I just said, with like writing out the kind of table of stuff they needed to do in the day, making sure if there was periods of the day where you were particularly quiet, that you were kind of doing stuff that you, so say you've got something due at like 3 o'clock and it was like 2:15 and you didn't have anything to do, but this list at 3 o'clock was like 5 things, then I'm going to do like 3 of them before 3 o'clock, so I'm not doing everything at 3. So yeah, time management as well. And I guess with pediatrics in particular is just kind of, you know, you need to be so patient. Sometimes it's really difficult working with children, as you can imagine, like, you know, they don't always behave and it can be really testing and challenging at times. And you have to be patient with them because otherwise I just feel like you're just not gonna, if you're not patient with them, kids know when they're pushing your buttons and they'll just be like, well, this is fun, I'm just going to carry on doing it. So yeah, those are probably like my top 3 things I would say.
Brilliant, that really made me laugh, the being patient. I definitely struggle with that. You've got the slightly harder job now, Manpreet. Have you got any other qualities? And also maybe you could answer Amy's question from sort of previous sort of chat about, she says, how did you find fitting lectures into studying independently?
So using that time management skill again is a must. You have to be prepared. So if you know that you have 3 shifts together, for example, make sure you give yourself rest on the end, at the end of the 3 shifts, and then work your way to do the lectures in the next few days and then back to placement. Don't try and fit placement and lectures on the same day, because it never works. You will just zone out. And also with the lectures, you can always, because they're recorded now, I think it's easier in one way that you can kind of do it when you have time. So if you're not feeling it after, because obviously with me, I have to travel quite a bit. With placement, I have to travel quite a bit, so I don't really get the chance to do the lectures after my placement. I have to kind of keep a separate day to do them on. And that works best for me, but it's whatever works best for you, to be fair. And with the skills, I think, yeah, I have to agree with Sophie. Communication is like the end and be all. It's like the must. You have to know how to do that. But the ability to build an empathetic relationship with the child is important, because you need to kind of know their likes and dislikes. Because if you don't know that, you can't really make that bond to communicate with them. They won't really understand if you're trying to get them to do something. You have to kind of be that kind of like a friend. So you have to kind of put their mode into something else, like a TV program or something that they like, so you can get to do what you need to do, even if that's medications or changing bandages, anything like that. Just distract them in a way that is calm to kind of get done what you need. But yeah, that's all really. I think Sophie's covered most of them.
Great. Yeah, I think those 3 ones definitely are the main ones from what you guys have been saying. Maybe you could both, there's a couple of questions surrounding sort of really unwell patients and how you sort of deal with your emotions and not let that affect you. Maybe Samanpreet, you mentioned that you were, I don't know if you said you still are, but you're on an oncology ward. Yeah. That's tongue twister, and palliative care. How, especially as a student, I know, well, from my own experience of placement, it can be quite challenging. What have you got any coping mechanisms? And then I'll ask Sophie the same.
Yeah, so there are moments. So I had on one of the days I had a specific palliative care patient who was like an end of life care, and it's really hard to kind of know that and then go in and care for them, because it's like you feel really kind of emotional, but then their parents are there, so you have to kind of hold it in until you can. But it's always okay to like go in the staff room and have a cry. Like, it's okay to do that, because we're all human at the end of the day. But it's just best not to make the patient feel like, they're kind of nothing. It's still talking to them as normal, doing everything you can as normal as possible, just for the best outcome, just for the best last end of life for them. Try to spend as much time as you can with them, because sometimes what happens is when you have palliative care patients and you have other patients, it's kind of the division of time that occurs quite a lot. So you kind of feel like you're not going into there as much because family's kind of there, but it's always best to pop in, talk, because sometimes they do want that conversation with you, just to feel like, yeah, they're still being cared for, there's still people there looking after them. So even if it's not doing a lot in there, it's just going in to have a conversation with the patient or the family member, because they might need it just as much as the patient. But then obviously at the end of the day, it's their choice to take the patient, to make that care at home at the end of the day, or to leave in hospital. But always give them the option and tell them what you can do in hospital if they find it easier to do it there, like to be there with the child or to be at home. So yeah, it can get quite emotional. I think I've had some days where I've been a bit like, can I do this? Like, I need to change my ward. But then it's like looking at other nurses, you ask them about their experiences, and it's like a learning kind of way, and you kind of get through it. But at the end of the day, when I finish a shift, I actually feel good that, you know what, you've done what you could, and kind of give them the time, give them the effort, and it's just that feeling of like, yeah, I've done what I could.
Absolutely. And I thought of a question while you're speaking about, so obviously a big part of pediatrics must be the parents, as you've both kind of hinted at. How, obviously, because communication is probably even more important, because you have to communicate with both the child and the parent. How do you find that?
So in the beginning, on my first ever placement, I was terrified. I was not so good at communication, but it's just kind of learning the ways to do it. So what I started to do is I started to go in and like, I was telling the nurses who I was with to let me give a bit of a lead. So I was like, allow me to like give an introduction first and then kind of pop in. So I was kind of doing them things, and I was learning that every patient and every parent is different in their own way. Sometimes when you go into a patient's room in the morning, they don't want you to talk to them for like an hour. So you kind of have to know, like, okay, leave these people alone, they don't want to talk to you. Whereas some of them, they're like, okay, we're up, we want you to say hi, good morning, and talk to us and stuff like that. So it's kind of just knowing what people want from yourselves. And that can be hard because sometimes you don't really get the same patient, as I said before, because it's usually a different patient every day. But it's always best to read their notes, because sometimes nurses do leave little comments, especially when it's like those parents who are like, no, I don't want to talk to you yet, or I'll talk to you soon, but just not yet. Because everyone's mornings are like that. I can talk to myself, like in the morning, if you're talking to me, I can just be like, no, just give me 30 minutes and come back to me afterwards. So it's just kind of knowing who likes to be talked to as much and then who doesn't. But yeah.
Absolutely. And I think you hit such an important point about sort of every patient and I guess their families being individual. I think that's really important across sort of healthcare. And Sophie, how do you cope with the job being emotional at times?
I guess I think personally I deal with it quite well. I think kind of just when I'm at work and on the go, like it's my job and I'm there to look after them, and kind of I do put I wouldn't say I've got a flying in my face, sorry. I put my feelings to the side while I'm at work, but I always make sure that I reflect. So that's something I was always encouraged to do, like as a student, and it's something I still do now. So I have like a little book which I like write reflections in, and I think maybe that's how I manage to kind of put my feelings to the side when I'm at work. Of course, you know, there's situations that come up that do kind of catch you off guard and you do kind of get emotional to them, but it's just important to remember, you know, that we are just human, that, you know, speak to your seniors, speak to your colleagues. Most of the time, you know, if you needed to take 5-10 minutes off the ward, like just to have like a few minutes, like that would be a possibility to go and do that. But yeah, like I said, reflecting to me like is such a valuable tool to kind of help get through those sorts of things. And I mean, there is obviously different specialities that are kind of, I think, more emotive than others. Fortunately, within my ward, it's most of the time they have their like what procedure that they're coming to have, and then they'll go. Like sometimes, you know, they can get really sick, but you know, there's particular specialities which I think are probably more emotive and more emotional than others. Yeah, so it's just, I guess, finding your niche, because I mean, one of my really good friends I trained with, like she works in oncology and hematology, and I'm like, I don't think I'd want to do that. So it's just kind of making those, like acknowledging, you know, that's a great specialty, but it's not necessarily for me. And that doesn't make you a bad person because you don't want to work with those sorts of patients. It's about acknowledging like, well, who am I going to give the best care to? Because if you're going to be emotional and crying all the time, you're no use to anyone. So yeah, it's kind of, I think that's why when you are a student, try and get as much experience in as many different places and in many different wards as you can, like even if you're not necessarily on placement there. So like I didn't do a placement on oncology, but like I was in a hospital that had a department which ran from there. So I made sure like, okay, like I'm going to speak to someone from that ward and I'm going to say like, can I do like a few shifts here just to get a bit of experience? Because yeah, you don't know until you've tried something.
Definitely, I think that's really good advice. And I think at the end of the day, your job is important, but it can't take over your life if it's, you know, really affecting you. That's not fair, and there's no need for that. And sort of what I asked Samanpreet, how do you find sort of communicating with parents as well? Is that something I haven't thought about before?
Yeah, it's funny because people always say to me like, oh, like I don't know how that you can like work with children. I'm like, well, most of the time it's not the children that are difficult, it's the parents. And it, like, in all honesty, it can be really difficult at times working with parents, which is why I emphasize how important communication is, how just like being open with parents. I always try, you know, even if I don't know 100% what is going on, or like what the plan is from the doctors, I'll always be open with parents and say to them like, look, I'm still waiting for someone to get back to me about this, or we're still waiting for some results, because one thing parents hate is being kept in the dark. So I think if you can keep them up to date and just be honest with them and just say, look, we don't know what's going on, but we're trying our best to find out, they appreciate that a lot more. And also just sometimes just realizing that silence is okay. Like, don't try and fill like awkward moments. Like, I have to take so many parents down to like the anesthetic room, like when before they go in for surgery, and like I've had such a range of emotions of like, you know, parents like literally being beside themselves, and some parents being really chilled, and like sometimes just not saying anything is better than trying to fill the silence with some like really meaningless, like awkward conversation. So yeah, just kind of gauging how to deal with the situations, which it comes in time. Like, I'm pretty sure that when I first started nursing, that I probably had some very awkward conversations with parents trying to fill silence, and they're probably thinking, what are you talking about? But yeah, it's just something that you learn and you adapt. And I feel like no one nurse is the same as another. We all work in very different ways, and it's about learning what works for you, like what you're comfortable, like how you're comfortable communicating, like, and then you'll see like, okay, I communicated in that way with those parents and it really didn't work, like what could I do to improve it? But the same with that, like no two sets of parents or carers or family are going to be the same either. So it's just remembering, you know, to just go about every day like with a new kind of lens on, and just kind of go in and just in the morning just kind of psych out, like try and have a conversation with them if they're awake. Have a conversation with them and just kind of get a feel for like the parents, get a feel for kind of, are they quiet, are they chatty? Like, yeah, I think having that first conversation and making like a good impression during that first conversation with them is like, yeah, it's vital kind of for your ongoing kind of relationship with parents.
Great. That kind of made me think of when we did one of these work experience events with a midwife. She spoke about kind of reading the room, like kind of emotions and personalities. I think that's kind of an added skill of being able to kind of adapt your communication skills, I guess. But I think, like you highlighted, like all of these things just take time. You're not going to be the best communicator at the start, and that's okay. But I guess when you're thinking about writing personal statements and things, it's showing how you're developing these communication skills already, and you'll be surprised with how many things. I mean, you use communication skills all the time, right? So don't overcomplicate it, but just show how you're developing it, or how you sort of plan to develop it, and show that you're aware that it's an important skill, I guess. And then sort of my penultimate question, which somebody else has kind of asked about, was about the multidisciplinary team. So what members of the multidisciplinary team do you work with in orthopedics, spinal and general surgery, was it?
I mean, because we are a surgical ward, we work with a massive team. Like, it's part of the way that we like work with the rehab part of like our care and things. So physiotherapists, obviously with orthopedics and spinal, they're a massive part of the patient's rehab and getting them home. We also work with occupational therapists as well, especially with our more complex patients, our wheelchair users. They come in and kind of do those sorts of bits with them. Dietitians, they'll come in and have their input as well for patients that are either kind of in hospital for long periods of time, or if patients that are already kind of have feeding plans out in the community. We'll also kind of we'll work closely with the safeguarding team if, you know, we've got families that are already have kind of support outside of the hospital setting. Who else do we work with? We have clinical nurse specialists that we work with. So we have like an orthopedic clinical nurse specialist. So they're basically just very senior nurses who, so for example, the orthopedics clinical nurse specialist, like she is like the oracle of all knowledge when it comes to like orthopedics. So at one point, you know, she was just a band 5 like me, and then with it, like through time she's gained her expertise, and she kind of we'll go to her if we have kind of wounds that we're concerned about, She sees our patients in clinics. She also sees like the patients alongside with the consultants, organises stuff for discharge and things in the community as well. So we have quite a lot of clinical nurse specialists within just the hospital in general, so we work alongside a lot of those. We also have play specialists, which we use a lot on our ward. So they are kind of just a really invaluable tool to help us kind of with distraction and things, if we're doing bloods, or if we're having like particular procedures which we need kind of help with distracting our patients, because unfortunately sometimes we're not there all the time to be able to play with our patients and be able to distract them, because if we need to do something medical, it's really good to have the play specialist there as well. So they're just like a handful of people that from the multidisciplinary team that we work with, but I mean the list would probably go on and on and on.
Great.
We work with a lot of other people. No, you're right, I finished.
Sorry, your signal went a bit off.
Oh, did it?
So
Sorry.
just right at the end. No, just right at the end.
Okay.
No, that was really helpful. I had a bit of a stupid question, but stupid questions are allowed in these sessions. Is a clinical nurse specialist the same as an advanced nurse practitioner or not?
See, so within paediatrics, in my hospital in particular, we do have kind of an advanced nurse practitioner role, which we call a PNP, which is a Pediatric Nurse Practitioner. But the Pediatric Nurse Practitioners are more generalised, so they're not really specialised. So in theory, kind of like they're at the same level, like they're very senior nurses, and but the nurse specialist is more kind of, they have their niche and that's what they work within. And then the advanced nurse practitioner role, they are within my hospital, it might differ to other hospitals, they're more kind of generalized to just everything in general that they come and help with.
That makes perfect sense. Thank you. That completely answers that question for me. And Sam and Preet, we had a question earlier as well about sort of oncology, multidisciplinary team. I imagine there'll be a lot of overlap with Sophie's answer. But what members do you work with?
Yeah, pretty much all of the ones that Sophie's mentioned, but especially with play therapist, usually when we tell people, okay, so we're bringing in play therapist for the child or whatever, they presume that it's just for the child, but actually play therapists usually go out of their like comfort zone with the children and actually help the patient and patient's family members. So what usually happens is when they're kind of done with distracting the child, or when the child's gone for the procedure or interventions, whatever they need to go for, the parents are usually left behind, and usually they'd go for drinks or something. But sometimes you have patients, especially on oncology wards, where they're really frightened when children have gone to procedures, and they just need someone to talk to, and usually the nurses then are quite busy to actually go and sit there and just talk. Whereas then the play therapist can go in and kind of discuss what's going to be happening in the procedure with the child to the family member, give them some relief, answer any questions that they may have. And then if they are unable to answer some of the questions, they can then go and ask a nurse. And that way it saves the time of the nurses who have got other patients to look after as well. And the play therapist has already made that bond with the child, and therefore with the parent, to be able to communicate these kind of situations and answer any questions that they may have. So they are quite important for children, and especially with some of the skills that they have, they kind of know the child so well to decide which toy will be able to distract them for certain situations and which not. And sometimes I look at them and I'm like, wow, that was easy for you, and sometimes it takes us forever to like get them to settle down and sit down so we can do procedures. But they're really good at that job. And then working with doctors, even though it doesn't seem like we get much work done with doctors on wards like oncology ward and liver unit, doctors work closely with nurses to discuss like the overall care, and also dietitians in liver wards, because it's really important to actually decide what the patient can have, or if they're on like no eating at all kind of diets, what supplements they can have to actually carry on without having food and stuff. And it's really important that they come and see them quite often, so that nothing is going wrong or nothing's missing out. But yeah, pretty much.
Perfect. That's really useful, really helpful. I think talking about the multidisciplinary team and giving examples of who you might work closely with is something really good to do in personal statements, interviews, whatever. We've had quite a few questions, so I think I'll end sort of my questions and then I'll just direct some random ones at both of you for the next sort of 10-15 minutes, if that's okay. Please feel free to pop any more questions on the chat and I'll try and ask the most relevant ones. We've had a couple of questions about sort of work experience, which I guess is quite important to address. I think my personal answer to the whole work experience thing is work experience is anything that gives you an insight into both the degree and the career. So it's not just clinical work experience. Actually, I did some clinical work experience and learned absolutely nothing. So, you know, it can be anything from this to reading a book, podcast, all of that stuff. But I don't know how this year is working, whether there's any options for clinical work experience, but do either of you have any tips on the work experience topic?
So with me, I came from a background with no experience at all to do with medicine or anything clinical related. But when I was deciding if I wanted to do adult or pediatric, I did do a experience at a care home. And that was just, they probably don't do it yet now because of the pandemic. I don't know if they do, maybe some places do and some don't. But when I did that, I did it for about 2 weeks. It wasn't even that long, it was like 2 weeks. But in those 2 weeks, I had decided, okay, adult's not for me. I'm going to stick with pediatric. And then to do pediatric, they do some volunteering work in schools, I know some of them, so you can ask for work experience in schools. And that's obviously year groups. You can choose what year group, but they do it in primary schools, and that's basically you get quite a lot of experience there because you work with different kind of children, and they are usually telling you that they don't want to do things and you have to kind of tell them you do, and it's similar to the clinical practice. So it's just getting things done when you need to get them done. But that's it really, not much. Well, I came from a background with no experience at all, but with pediatric, because I couldn't decide what I wanted to go in then, but experience, if they're available now, it's good to get something in.
But I think that just goes to show that you definitely don't always need hospital work experience, especially this year, guys. And Sophie, I know that you didn't go straight into nursing, but what would be your advice?
Again, exactly the same. I didn't have any clinical or like medical experience before I went into nursing, so please don't let that deter you. I think kind of just having a really strong personal statement is like super important when you come to applying work experience wise. I think, you know, just looking around the local area, seeing kind of what sort of work experience is available. It is sometimes difficult to get work experiences in like hospitals, because I think because of insurance and things like that, I know like my hospital doesn't take on like work experience per se. So having a think and looking about other places you could do work experience, like going to a school, because it's all transferable skills. So you just need to remember, like, just because it's not necessarily medical doesn't mean that it's not going to be valuable to like learning things. Yeah, just like do research in your local area, reach out to kind of, maybe, I'm not 100% sure whether like GP practices would be kind of better to speak to in terms of like work experience, but I just know from experience where we've had people approach my work before, I think some hospitals are a bit funny kind of about having work experience, but definitely, yeah, thinking about transferable skills, no matter kind of what work experience you do, like there will be something that you learn from it. And especially like we've spoken about the importance of communication, you could do pretty much anything kind of work experience wise and learn something from it which you could transfer and use if you went on to do nursing.
Yeah, definitely. I think even things like, you know, working in a supermarket, literally anything, so many skills. Like at the end of the day, patients are sometimes customers, or they think they are at least. But also, yeah, from my experience, I'd say GPs, I didn't have, obviously I'm not a pediatric nursing student, but same thing, healthcare student. I didn't have any hospital-based experience, but GP, I literally emailed like every single GP in my area. You won't be able to do work experience at your personal GP, but just everywhere else, just spam them with an email. They might feel sorry for you during a pandemic, and yeah, I can't see why they wouldn't actually take you, especially as now a lot of them are not doing as much face to face. Also, another one would be like vaccine hubs. I know where I'm working, we're looking for volunteers. So if you're based in North London, send me a message. But just, you know, some of these opportunities are about hassling people a little bit in a polite
just
way.
about being proactive, isn't it?
Yeah, they're not going to necessarily be on Google search nursing work experience and then pop up. You know, message people on Instagram, on LinkedIn, but don't worry too much about the sort of clinical work experience. I think is the overall theme. Do you either of you have any other sort of advice about applying and general tips for like the interview process and things?
For hospital and work experiences, one of the things is you probably won't get a work experience there, because what they look at is loads of safeguarding paperwork and stuff, and you might not have that ready because you haven't really been to uni, unless you are at first year uni and you have the certificates to say that you've done the safeguarding courses and manual handling courses and stuff, because you do need that for proof, just to say that yes, you've done the safe care and safeguarding kind of things. To get work experience, so it's probably harder to get them in hospitals. But things like schools and play schools and infant kind of cares, they do placement. So have a look at things like that around you.
Great. And somebody's asked about sort of mental health, and I guess, I mean, listening to you say you have like 12-hour placements as a student, and then you're going to like lectures, and I mean, I guess just shift work in general for you, Sophie. How do you deal with all the like sleep deprivation and everything, and how do you just deal with 12-hour shifts? Like, I don't know how I'm gonna cope.
Yeah, when I had my first 3 nights together, and there was 12 hours 3 nights together, I'm really bad at sleeping in the day, so I found it really hard to actually get a sleeping pattern where I could sleep. So on the first night, I remember coming home and sleeping for like 3 to 4 hours, and then I was like, how am I going to do another night when I haven't slept? But when you kind of start doing them, you kind of find your own routine. So some people find it that they sleep till late in the morning and then get up and then go for their night shifts, whereas others wake up really early in the morning and then have like breaks, naps in the day, and then get ready for night shifts. But it just depends on the kind of person you are, because for everyone it's different. So you might be the morning person or you might be the nap person. But that's it really. And then with lectures, what I do is, because with mine I have quite a lot of traveling to placement as well, so that's kind of time consuming. But what I try to do is I try to get my shifts together if I can, so it's like 3 days together. And that does sound really long when it's 12 hours, but what that helps with is that I know I'm going to get this 3 days done, and then I've got time to do my lectures in the remaining days, instead of doing like placement in out. But it just, again, depends on what kind of person you are. If you prefer doing lectures and placement to get you dressed, then fair enough. But I'm sure in 3rd year they give you an option where you can kind of choose placement areas. I don't know if all universities do that, but with the pandemic, obviously that might have changed as well. But you get an option, so you might want to choose a place that's closer to you to do the lectures and placement together, if that's easier, if that's something that you would look for. But yeah, it's all manageable once you start doing it, because you just have to have the time management skills and you kind of get it done.
Brilliant. And Sophie?
Shift work wise, I don't think I try and have like a sort of a routine, but I just kind of prioritize rest on my days off. That's kind of the most important thing to me. But rest in kind of different ways, and self-care, I guess I probably say more than rest, because I'm one of these really irritating people that even when I have days off I like to do stuff. So it's just like making sure that, like, you know, on my days off I'm doing something that I enjoy to do, and just, yeah, like I said, prioritizing rest is super important, because within all jobs, but especially within healthcare, like burnout is a real problem. and it's kind of making sure you are aware of like the signs of yourself getting burnt out. Like I'm still 2 years in, and sometimes I find myself kind of like, oh yeah, I can feel myself getting burnt out. And just making sure that, you know, you do look after yourself, because like they are hard, and some shifts, you know, you come home from and you're like absolutely knackered. I don't know what it is, but I don't mind doing 3 nights in a row, but I hate doing 2 long days in a row. Like I do 2 long days in a row and I'm like, oh, this is awful. But 3 nights, I'm like, yeah, 3 nights is fine. So yeah, I think it's just like making sure you look after yourself. And obviously, if you, like when I was a student, at my university, actually, I was never doing lectures at the same time as placement. I think every university is different. I think probably like when you go and look at universities, maybe that can be a question that you ask them, because I think it's really important about the balance of like placement and lectures. So yeah, it's always really good to have questions to ask when you go to interviews and have like the interview process. So I think that's a good question to kind of keep to hand, to just ask how they lay out their kind of year, so that, you know, because it's like, I know I don't even know how I used to do it now, and I'm like, how on earth did I do uni at the same time as like doing all these shifts? But yeah, just make sure you look after yourself, because it's very easy as nurses, sometimes we're looking after other people, that you forget to look after yourself. So I think sometimes, you know, they encourage us to take kind of regular annual leave. So like, even if we're not like going on holiday somewhere, they'll say like, well, you know, like you've had this amount of weeks on, like, or like a couple of months on now without any leave, like maybe you should take like a few days leave. And then like, it just gives you like a bit of time off, just because even though, you know, I hate personally not doing anything, like it's so good to just have like a week off and not do anything. You just go back to work and are so refreshed. So yeah, those sorts of things, I think, probably.
Great, that's fab advice from both of you. And then the sort of last 2 questions are surrounding sort of careers. I don't know if either of you will know much about this or can point these people in the direction of where they can find out the information. But Amy's asked about sort of becoming a nurse researcher. Do you know anyone who is a research nurse? And the other question is surrounding this sort of clinical nurse specialist you were talking about, Sophie, and how you would kind of progress to be one if you wanted to.
So clinical nurse, like a research nurse, most trusts will have a research department. So it would just kind of be, in essence, the same as applying for any job. I know at my hospital, it's kind of a band 6 role, so you would potentially need to kind of just do general, like a newly qualified year, and then go into it. But yeah, it would just be kind of one of those things that, you know, you'd find the job and you just apply for it. Research, again, is very broad. Within my trust, kind of positions pop up like internally a lot. So like, you just kind of, if you saw like a research position, like, and that's what you were interested in, then like just go for it. But yeah, most trusts will have some sort of research. So it's just about kind of doing your research into those sorts of programs, and whether they're particularly pediatrics in particular. Obviously, it's a lot easier if you're working at like a specialised children's hospital, because they probably have a allocated peds centre for it. But yeah, it's just kind of like looking into these things. There's no reason why it would be difficult to get a research job.
And the the clinical nurse specialist, is that just a time thing?
Yeah, so clinical nurse specialist is normally a band 7 job. So if you think you start as a band 5, it really kind of depends where you work. London, and I'm not sure about other big cities, but you do progress a lot quicker in London. So yeah, it's just about time, it's about experience, because if you think you're going for, it's in the name, you're going to be a specialist. You can't be a specialist if you haven't got the experience, if you haven't got the expertise. So it's just about finding a niche, finding what you're passionate about, and then just working up, like kind of up the ranks. I mean, you'd probably go from being a 5 to then being a 6, and then you hopefully over time would have enough kind of, you're never going to know everything, but obviously like with those sorts of roles, you are kind of more of an autonomous practitioner. So you're kind of, you know, having to care for patients even more so than we do independently. I know a lot of the CNSs at my hospital like run their own clinics and things. So you need to be kind of experienced, confident, and know your stuff.
Great, thank you. That explains, yeah, perfect answers. And then my final question for both of you is, if you cast your mind back to when you were applying to university, what is the single piece of advice you wish you knew? Sam and Preet, do you want to go?
Yeah.
Sorry?
The interview process for the university, I wish I knew what kind of questions they were going to ask. It went better than I thought, though, eventually. But when I got there, I was really nervous, and I was like, oh, I never knew this was going to happen. And it's kind of like an iPad interview. So it gives you like a case study about a clinical kind of procedures or something to do with the child, and then you kind of have to answer it. And because it's on an iPad, it's really weird because you're kind of listening to someone speaking, but you have to pretend like it's a real thing happening in clinic. And it's like, I can't really understand how this would be in clinic, because if someone like me, because I had no previous experience, it was really hard to kind of imagine that in a clinical area and answer the questions. But you do that, and then it's like an interview with the head team in the university and asking you further questions. But I just wish I knew kind of what sort of questions and what kind of things they were going to do in the interview.
And how can someone sort of clue themselves up about interviews? Have you got any good sort of resources? I can't speak, you know what I'm trying to say.
Yeah, so when you apply for the university, on their page they should have like resources page where they give you like information about different nursing, and you have to have a look if you're meeting the equivalent grades criteria, if you're meeting the skills, and then always find examples for the skills that are written there, so you can kind of explain in the interview to back up that where have you used this before, to say that you have done those skills and you have qualified to do this job. But that's it really.
So think about the skills that you both mentioned, basically, and your examples of those. And Sophie, what do you wish you knew back in the day?
Back in the day, it wasn't that long ago. So mine was slightly different, because where I already had a degree, like I basically I wasn't waiting on any grades. But I wish I knew that I did know, but like not, I wish I had more time to know that they do. I think most universities for nursing, you have like a numeracy and a literacy test. So if you're like me and not the most mathematical person, just refresh yourself. The best thing to do is, I found like there's loads of examples online of like the sorts of like exam papers and stuff that you get given, so just find those. And the same with the literacy one as well, like just literally, I think I just googled like nursing interview like maths tests or numeracy tests, and it came up with loads, and just practice them, because like the last thing you want to do is go to an interview, you're already going to be like super stressed, but like don't add any more stress than you need to. I think like my top tips for the interview would be, they don't expect you to know everything. That's why you're going to uni. So don't go there and think that you need to know everything, but they just want to see that you're willing to learn, that you're passionate about what you want to go into. So like that you're passionate about going into pediatric nursing, kind of just why are you passionate to go into pediatric nursing? And again, you don't need to have a perfect answer for everything, but just, I think just showing that, you know, you're proactive, that you're enthusiastic, you're passionate. They're just really important things to show like when you go to your interview. And the same sort of thing kind of with your personal statement. I know I'm going off on a tangent now, but when I wrote my personal statement, my top tip would be to use like the NMC 6C. So like the 6C, in that we are governed by a body, if anyone doesn't know, called the NMC, who are the Nursing Midwifery Council, who at the end of your training, you get given a pin that basically says you can work as a nurse. And they have something called the 6Cs. And basically it's 6 words beginning with C, funnily enough, that kind of they describe what they think a nurse should be. So I think if you're struggling with a way to kind of like, what's the word, what am I trying to say, with a way to structure your personal statement, using those 6 C's is a really good way to like set it out, because there's 6 different things, and if you can show that, and then they'll be like, oh, that's the 6 C's, they've researched into that. So yeah, the NMC is a good thing to look at, like personal statement stuff, and also say like the RCN, things like that, just kind of doing your research. And also doing, like, if you include in your personal statement something about, you know, up-to-date nursing, because even within the last year, nursing has changed like a huge amount, and just showing that, you know, you're up to date, you're aware of what's going on. Like, they want to see that you've got a different sort of personal statement, that it's not the same as every other person that's like handed in a personal statement. So if they've seen, oh, this person's like, you know, actually like written about something that's going on in the world right now, that's really interesting, like that's always a good thing.
Fabulous. I don't think that was going off on a tangent at all. I think that's great advice. I didn't have a clue. Well, I know what the NMC is now, but it's all these abbreviations. It's just healthcare and abbreviations just drive me mad. But thanks so much, guys. I've put both of your Instagrams on the chat. If it's okay, if anyone has any questions, they can just send you a message. I know sometimes after you just leave these things, you're like, oh, I wish I asked that. Make sure you give them a cheeky follow as well, guys. And thanks so much for coming along, everybody. I've put the little URL for the to get your certificate. Any problems with that, just send Future Frontline an Instagram or email. And yeah, thanks so much, Sophie and Sam and Preet, for giving up an hour of your time to talk to all of us and educating all of us. It's been super helpful. And yeah, thanks so much, guys. Enjoy the rest of your evening.
You too. Bye.
Thank you.
Bye,
Bye.
everybody.